Welcome to Marshfield Medical Center's Birth Center in Marshfield. Having a baby is an exciting time, and we want to make sure you are prepared for your hospital stay and ready to meet your new little one. A good sign you are in labor is when your contractions are 5 minutes apart, lasting for about 1 minute for 1 hour. Remember, 511. Call the Birth Center at 715-387-7071 to let staff know you are in labor and you will be coming to the Birth Center, or if you have any questions or concerns during your pregnancy. Come to our hospital right away if you have any bleeding or you think your water broke. When you go into labor or arrive for admission, you will come through the hospital main entrance during the day or emergency department entrance after hours, then go to the central elevators to the Birth Center on the second floor. Follow the Marshfield Children's Hospital signs to get to the Birth Center. Upon arrival to the unit, notify staff of your arrival by pressing the Birth Center button. The Birth Center is locked and staffed 24/7 to be ready for you and your baby's arrival. Once you are admitted to the Birth Center, our labor and delivery nurses will offer you many labor coping tools like birthing balls, aromatherapy, massage tools, and our bathtubs to help with labor. You can share your birth plan with your labor and delivery team, but also keep an open mind because labor is unpredictable. You may choose 2 support people to be with you while you're in the labor and delivery room. They must be over the age of 18 and the same 2 people for the entire delivery. We have different pain control options, including IV medications, epidurals, and some unmedicated options. Discuss these with your provider while creating your birth plan. After delivery, you have the option for delayed cord clamping, and your labor support person may be able to cut the cord after delivery if desired and if your baby is doing well. Once your baby has arrived, we encourage skin-to-skin contact, also known as the golden hour, to allow you and your baby to bond and establish breastfeeding. You will spend 2 to 3 hours in the labor and recovery room before moving to your postpartum room. While in the labor room, your newborn will receive the vitamin K injection and the antibiotic eye ointment. We also recommend your baby receive the hepatitis B vaccine within the first 24 hours of life. Your nurse or provider will ask for your consent before any care is provided to your baby. If you need to have a C-section delivery, the room is located just steps away from our labor rooms. We encourage skin-to-skin contact and breastfeeding after a C-section birth as well. Marshfield has a nursery available where some newborn procedures are done, like hearing screen and circumcision, if desired. Most other routine newborn procedures are done in your room. It is recommended that you keep your baby in your room with you throughout your hospital stay, except for short periods of time for procedures when necessary. This helps to ensure that you are ready and prepared to care for your baby at home. We have quiet time for families from 1 p.m. until 4 p.m. You can have visitors from 10 a.m. to 1 p.m. and from 4 p.m. until 8 p.m. Special restrictions may apply during certain times. Your baby will have their own bassinet, and they are safest there sleeping swaddled on their back. Once in your postpartum room, your partner will have their own pull-out bed. If you have a vaginal delivery, you may be discharged after 2 days, and a C-section may take 3 to 4 days before you leave the hospital. You may be wondering what to bring to the hospital. You can pack a phone charger, personal care items such as a toothbrush, toothpaste, shampoo and conditioner, and your own comfortable clothes and snacks if desired. Your baby will need an outfit to go home in, a blanket, as well as the car seat. Breastfeeding is brand new to you and your newborn at this point. Lactation consultants will meet with you to help you with feeding techniques. We recommend breastfeeding your baby on demand or at least every 3 hours. Do not be surprised if your newborn cluster feeds those first few days or weeks to establish a good milk supply. Your baby's belly is only the size of a small grape, so they may nurse frequently. Lactation services are available for education and support during your hospital stay. Safe formula preparation education will also be discussed if needed. Your nurse and pediatrician will visit your room daily for exams to make sure you and your baby are healthy and happy. For more education during your pregnancy and beyond, you can use the Enjoy magazines and informational folder about your upcoming hospital stay that you received from your women's health provider. Enjoy also offers online classes for information on childbirth, breastfeeding, and more. These classes are available in Spanish and several other languages. Thank you for choosing our birth center for your newest arrival. We can't wait to welcome you and your family.